So you're capturing a cancer, you're capturing a lethal virus inside the patient, stuff like that. Yes, that's the rewarding part. That's what's very positive. Positive for us because you don't see them all the time. Negative for the patient. They're gonna receive some bad news based on what we caught. So, a left shift, a right shift. You're going to have to be able to multitask, definitely. You're going to have some common sense. Common sense is going to definitely be needed, and you're going to have to be willing to perform repetitive tasks.
Today, I will be interviewing Ramon Leos to learn more about what it's like to work as a laboratory director. Mr. Ramon, thank you so much for being here today. We really appreciate you taking the time out of your day to come on the show.
Thank you for having me. Appreciate the opportunity.
Of course. So, we're going to go ahead and get started. 3 questions that we always like to start off with are: one, in your own words, what do you do? Two, where do you live? And then lastly, as a kid, what did you want to be when you grew up?
Well, in my own words, my job is basic laboratory operations of the entire lab, and it involves management, technical component, and troubleshooting questions that my staff, physicians, or patients might have of a laboratory test. I also serve as a little bit of doing some consultant work on the side as well. So it all varies. I currently live in Los Fresnos, Texas, and not very far from where I'm working. And as I was growing up, I really didn't have an idea what I wanted to do when I grew up, and I was just basically taking it one day at a time, enjoying my youth, and not worrying about a career or anything like that. It was until I was after I graduated, then that's when I actually started looking at career paths, etc.
Okay, interesting. And then how long have you been working in this field?
In May of this year, it'll be 29 years.
Wow,
Mhm.
29 years of experience.
Yes.
What made you want to get into this career path, and how did you kind of get your start?
Hmm. Well, first of all, you kind of have to love science to a certain degree in order to enjoy this career field. So that's part of what I enjoyed. The other part is also, stability and, you know, the availability of the jobs are a lot higher than, let's say, a biology degree or a chemistry degree. Those jobs are a little bit more limited. Chemistry not so much, but biology definitely. Those jobs are a little limited as far as where they're going. So that's why I kind of moved my way into the lab science, because there are abundant careers out there for it.
Got it. So you mentioned after graduation, you kind of started to get your interest in this field. Did you end up going to school for something related to what you're doing now?
No, no, actually, I was working, and I was actually working retail, and I did not have at first I did not have any interest in going back to school. I had taken some classes and decided to step away from college, and it was until 3 years after I was close to 2021 that I decided to go back to school and focus on my education. But
Got
no,
it.
it was more of openness with the nursing directors or the nursing program directors at the local universities, and radiology directors, and also the laboratory directors in charge of those programs, that kind of opened my eyes to the different availabilities of the careers. And back then, I don't know about now, but back then they used to let us shadow these people. So I was able to shadow people here in Brownsville, Texas, and in Harlingen, and that's how I came to decide on the laboratory, because I found it very interesting and behind the scenes, etc. And
Wow.
it can just branch out to so many different careers. So
Right. Wow. So that's kind of how you got your start. Are there any specific degrees or certifications that one may need to acquire to be a laboratory director like yourself?
yes, you will. Most institutions, I want to say over 90% of the institutions are going to require a medical laboratory science degree with a minimum of a bachelor's degree. And right now there's some places that are even requiring master's degrees. in the lab sciences or relate, or they can have the MLS, which is a 4-year degree, and either an MHA or an MBA for them to actually go into the leadership roles. I myself have an MBA.
Okay, interesting. And are there any other job titles that this position goes by, or is it primarily just laboratory director?
No, if we follow the CLIA guidelines, the laboratory director is technically the pathologist, and our job titles are not really included in there. We're included within the MLS, and it would be a laboratory administrative director for other facilities. So the majority of facilities out there would call it laboratory administrative director to have that differentiation between the pathologist or the doctor of the lab and the leader of the lab.
Right. So it's kind of like a branch, and then there's several under that kind of big hierarchy.
Correct.
And what are the specific tasks that you spend the majority of your day doing? So, kind of walk us through a day in your life as a laboratory director. What does that look like?
Well, a lot of it is paperwork. A good part of it is paperwork, and that's for compliance issues. The laboratories are heavily regulated by CMS and the federal government, I should say. The federal government regulates us, so there's a lot of pieces that we have to make sure that we're accounting for. Stuff like proficiency testing, accreditation, readiness, competencies for our employees. Those are all manual paperworks. And then the other piece is the staffing and making sure that the staff are adequately trained and ready for the tasks at hand. The last piece is the meetings and the operations side of it, the budgeting and all those good things that come with operations.
Right. So, in your job, what tools or technologies do you use that kind of help make it a little bit easier?
Well, you're going to need the computers, obviously. I mean, you can't really function in today's environment and compliance without a computer. So the computer, the programs within the computer, Office, uh, email, all these are valuable tools for any operations department in the lab. Everybody's going to need those. There's also other software that you will require for your special studies. Software that help you plot correlations and validations of testing. So they're all computer based. So a lot of computer is going to be the use of computer is going to be definitely required.
Okay, good to know. And what parts of your job are the most exciting or interesting to you?
What is most exciting? Well, for me, it was more exciting before all these standardized approaches that the companies are having. So I
Mm.
used to find it very exciting to research new equipment and prepare the laboratory for bringing on new tests and new equipment. Now it's being more controlled by a centralized approach, and they're basically telling us this is what you're going to get based on your size, and that research is kind of gone. So that's what was exciting, and I mean, it's just the way that things are going, standardizations.
Right. So it's just because kind of time is evolving and progressing. Is that why you think they made that new switch? Or was there a specific
Um,
reason to it?
I think it was also to limit cost more than anything, um, rather than the technologies out there, because we do need the technology availability, but I think this is just to limit the expenses.
Okay. Now, what parts of your job are emotionally challenging, draining, even sometimes boring, if it can even get to that level? What are the more negative sides of being a laboratory director?
Staffing shortages is a negative.
Hmm.
Um, the balancing of the generational gaps between staff is also challenging. It's not boring, it's just challenging. Sometimes it's emotionally draining. It's when we can't agree on certain things, and the staffing shortages, the employee turnover, lack of what we felt were people that wanted to stay in the career for 20, 30 years. That's no longer a trend.
Wow, why do you think that is?
It's the generations. They have a different mentality, in my opinion.
Mm, Got it. Now, are you able to leave all your work with you at the office, or are you able to sometimes take it home, or is it primarily just inside your office? That's where you get the work done.
90% of it is done in the office, and there is a good 10% that can and will at times accompany me home via the cell phone or emails, etc.
Right. As a laboratory director, are you able to work flexible hours in a remote or hybrid setting, or is it more common to work in office set hours?
It varies. I mean, we could do remote on certain instances, but the staff really do need since we have the staffing shortages and the turnover, there's a huge we have about I want to say 50% of our employees have less than 5 years experience.
Mm,
So that's not going to be very feasible. They're going to have a lot of questions,
okay,
technical questions. So
right.
yes, can you work remotely? Yes, you can. But you're going to have to come to the hospital at some point.
Yeah, eventually you're just going to have to get in and work those set hours and in-person setting. I'm sure that that's also beneficial to the overall performance of an individual, being
Right.
a laboratory director. Are there any busy seasons in this job? And if so, what are they? What parts of the year do you usually find yourself a bit busier than other times?
No, it's changed a lot. When I first started in the 90s or the late 90s, I should say, um, it was extremely seasonal, and it revolved around the winter Texans and the people that were commuting down here for for the winter versus staying in the upper states where it's a little colder. But
Hmm.
now it's not it's changed a lot, and right now it's very unpredictable. Sometimes you could start off the month very slow and all of a sudden it picks up, so it's no longer seasonal at all.
Okay, so it varies kind of year to year
Mhm.
overall
Yeah,
round.
especially like with the pandemic, it threw everything off, so it's now very, very
Yeah.
difficult.
Yeah, I'm sure it brought so much change to y'all's industry.
Mhm.
What do people underestimate about this profession?
What do people underestimate about this profession? I feel that they think it's going to be easy, and that that I also feel that they anticipate that everybody's at the same level, and they're not. There's variances between the departments, and knowledge base is not always there. And where they did their training is also critical. If you don't do your training in a high output type setting, and then let's say you did your training in a small operations, like maybe less than 100 bed hospital or clinic, yeah, you're going to be caught off guard
Mm.
thinking that you're going to be able to walk into a 300, 400 bed hospital and you're going to be able to function the same way. That's you're going to be pretty surprised.
Yeah. Do you ever encounter people who are kind of getting that surprise once they start this job?
Oh yes, because like I said, the employee turnover is out there. So yes, there's a lot of them that are surprised by what they're seeing.
Got it. Now, what do you think people overestimate about this profession? So, this can be an extreme positive assumption about what you do, extreme negative, anything overhyped. Or is there anything that you typically see people are overestimating about what you do?
They believe that it's a repetitive, and it is very repetitive, but there's also these one in a few where you capture these things. I mean, you're capturing at times the initial onset of a very poor outcome medical decision for the patients. So you're capturing a cancer, you're capturing, you know, a lethal virus inside the patient, stuff like that. So yes, that's the rewarding part. That's what's very positive. Positive for us because you don't see them all the time. Negative for the patient because they're gonna receive some bad news based on what we caught. So a left shift, a right shift, etc. A bunch of WBCs or blast in the blood. That's not good. That's not good at
Mm,
all. and we're the ones that are going to have to provide that bad or negative information to the clinicians to provide to the patients. That's probably the stuff that is very positive for us because you don't see those every day. Unfortunately,
Right.
it's not a good thing.
Right. It's kind of like half and half. You're excited that you found something. You're looking forward to kind of doing that investigation, but at the same time, it negatively affects your patients.
Correct, correct. That's
Right.
correct.
And what is the fastest way to get into this profession, especially if someone has a non-traditional background, they're looking to get into being a laboratory director or a laboratory technician? What's kind of the fastest way to get their foot in the door?
The fastest way and the surest way is to actually go through a structured program. What we've noticed is in larger cities, they do have opportunities where they'll take, let's say, a biology degree and try to integrate them into the laboratory because they have a little bit more staff and they're able to train them. But here, it's not that easy. On-the-job training has to be balanced with productivity and and the hours that are available. And what we found is that a lot of these new incomers that want that opportunity don't have a whole lot of patience. It takes you 2 years to master each category approximately if you want to be well-rounded. And some of these people want to do it in months, and it's impossible without the
Mm,
proper training. So they're setting themselves up for failure. And then when they try to, let's say somebody's doing this in Houston and they try to come down here and the only position available is for an MLS and their degree is in biology and they have not been certified, you can put on there that you've been working as a chemistry tech at facility X for the past 3 years. But we need somebody that's able to work blood bank. We need somebody who's able to work coagulation. And all you focused on was in chemistry. Guess
mm.
what? You're probably gonna have a hard time getting that job.
Got it. So kind of the fastest way is really the traditional way, going structured, getting your proper training, going kind of
If you
step
want to
by step.
go, if you want to work anywhere in the United States, I would highly recommend that.
So what other fields are people coming from before getting into this profession? Is it random or do you ever see a theme among that?
No, lately it's been people that really like the science, the natural sciences are the ones that are drawn to this profession. We have a lot of people that have gone that route where they get a 4-year biology degree or a master's degree. We had a couple that had master's degree in biology and they, the job is limited. And then they turn around and do an additional 2 years to get the program to actually be able to work in the laboratory. So
Mm,
biology, chemistry degrees. Chemistry, not so much because the chemistry degrees for in the chemical industry is huge. So you should not have a problem getting a job in those fields. But biology, that one's a little bit more challenging. It's basically teaching and a few jobs out there that require the environment, but a lot of them are state funded and there's not a whole lot of jobs out there.
yeah, so kind of just overall, not necessarily having a certain science background, but being under that science umbrella does
Correct.
very much help, yeah, in a
Yes.
position like this.
Yes.
What do you think that someone has to be extremely good at or like doing to be good at this job?
Well, you definitely have to be a problem solver. Definitely. You also have to be willing to multitask because the years of being a chemistry specialist are gone. You're gonna have to be able to cover micro. You're gonna have to be able to cover a little bit of blood bank. You're gonna have to be able to cover hematology. You're gonna have to be able to cover chemistry. So you're gonna have to be able to multitask, definitely. Uh, you're gonna have to have some common sense. You know, uh,
Mhm.
common sense is gonna definitely be needed, and you're gonna have to be willing to perform repetitive tasks.
Got it. How long does it typically take for somebody to get really good at what you do?
At each stage of the job, approximately 2 to 5 years, depending on the willingness of the person to learn.
Mm. Do you think that it varies, or was that kind of like the typical range where somebody gets comfortable in what they're doing?
Well, they're gonna feel comfortable right away. and they're gonna think that they've got it. And it's until you start asking the real questions and you start giving them the real challenges of the job that they start realizing, oh, wait a minute, I wasn't prepared for that. And
Mm,
that's when they realize, you know, it's kind of hard to prepare you for biannual correlations when you've only worked 4 months and you think you've got it covered and you haven't even hit the first stage of the biannual correlations and the reproducibility studies that are needed on some of the equipment. A lot of the manufacturers are taking this on, but if you're in a small hospital setting, like I mentioned, you know, maybe 100-bed hospital, a 50-bed hospital with limited resources and no umbrella of the larger companies, they're counting on you to actually do it. And if you've only worked
yeah.
4 or 5 months and decided to leave your job and go off to venture in the middle of nowhere because they're offering you a ton of money, you're you're gonna set yourself up for failure because you're not gonna know all the requirements that are needed.
Just kind of having that experience is really the only thing that can prepare you. I mean, you can go through your training, you can go through the structure, but until
Correct.
you're out on the field, there's
Correct.
only certain
Correct.
things you can learn once you're truly out there.
Correct.
Is there a promotion path whenever it comes to being a laboratory director? And if there is, what does that look like?
Well, you have to first off, all of us, when we're going through the program of training, we're all taught to collect blood samples. So you have to be able to do from the very entry level, which is phlebotomy, working your way up. You're gonna have to learn it in school regardless. So that means
Mm,
that even a phlebotomist can go back into school and become a laboratory director at some point if they get their career, if they get their degrees. So it would be, you know, the first step after your 4-year degree would be as an actual bench tech, what we call a bench tech, working the
okay.
chemistry bench, working the hematology bench, etc. From there, you're gonna have to show some interest and responsibility in wanting to actually take on more tasks. And at that point, you can be considered into the supervisory level. After the supervisory level, you're gonna have to operate the individual department within the larger department. So for instance, can you as a supervisor manage chemistry by itself, which is gonna require a lot of time management skills, a lot of multitasking in order to keep that department running. Same thing with hematology and coag, and the same thing with blood bank or transfusion services and microbiology. So that's why it takes so long for you to master all these to then get to the level of the manager. And then once you're the level of the manager, you're basically seen as the uh, the general supervisor. That's what CLIA calls it. And once
Okay.
you hit the general supervisor category, you're able to answer questions from all the departments. So nobody wants to have a manager that only has a specialty in chemistry, but has no clue what happens in histology, has no clue what happens in microbiology. And then after the manager job, then you can start looking at the director role because now you're actually helping helping people grow and being able to teach them what you know.
Yeah. So is being a director the highest role that you can have when it comes to this promotion path?
Correct. And then after that, you know, you would be the medical director, which you would have to go back to school and get a bachelor's, I mean, get a doctor's degree in pathology or anatomical
Okay.
clinical pathology.
Understood. And how long do you typically see people stay at each level? So going from manager to director and then sometimes going and getting your PhD again. How long do people typically stay at those levels?
Oh, it varies. It all varies on the person's comfort level, their age, and what they have in mind. If you want to travel, then you know you'll see anywhere from 5 to 6 years. If you want to make it a career path, it could be 20, 30 years.
Yep. All right. And then what is the average salary for somebody at your level? So you can give a range, even if it's super broad, or I know
Mhm.
sometimes it varies from state to state, just kind of an overall range that you could share.
Yeah, it all depend, like you mentioned, it'll all depend on a state by state basis and actual individual counties and localities. So it can go anywhere. I haven't seen anything. Well, I have seen anywhere from 80,000, 90,000, all the way up to 180, 170,000.
Got it. All right. When people in your field move on, what kind of work do they often go into next? Again, is it random or do you kind of see themes of people going into a certain field or do they just kind of springboard into anything? Or do they usually just stay as a
No,
laboratory director?
No, it all varies. It all varies what you want to do because like I mentioned, it it incorporates so many different fields that
Hmm.
it opens up different areas for us to be able to go. I mean, most commonly you'll see education where they go back and become professors or they go into the regular high schools to try to prepare young high school kids for college, etc. That's part of it. And if you specialize in chemistry, well, then there's all these refineries that want to hire people with experience in chemistry, quality assurance, and all these other aspects that have to deal with monitoring compliance for an actual chemical area. In addition, you can also go into forensics if you want to. If you have a little bit of background with histology and you've seen or witnessed a couple of autopsies, then you start gaining that experience with the forensic side of it. So it's really, really PA school. If you want to go into
Hmm.
PA school, it has all the core fundamental classes that are required for all these programs. So it really does prepare you for a lot. So that it's the sky's the limit. You can do a lot of things with it.
Yeah, I mean, like just a few of them you mentioned, it does seem to vary a lot. I mean, education, administration, going all the way into
Mhm.
forensics. So there's different places you can go into after a position like
Yes.
yours.
Mhm.
What books or resources or certifications, even programs, have you ever experienced that you think could help somebody wanting to go into, being a clinical laboratory technician or a laboratory director? Are there any that come to mind?
Well, the programs, all of your local universities and technical colleges will have those. So all of those are highly recommended. As far as certifications, you can get your foot in the door by starting off with a phlebotomy career and then working your way into the actual programs of study. So that would be highly recommended if you want to get your foot in the door into a lab and start from there. There is no way to get a certification for lab tech without actually having any experience. And even the federal government kind of regulates it because CLIA will not allow us to sit in for an exam without first having 2 or 3 years of experience in the actual laboratory. So it's going
Mm.
to be very limited. That's why I highly recommend the actual programs of study.
Yeah, I'm glad that you mentioned that because I'm sure a lot of our listeners don't really know that that's necessarily something that they have to go through in order to do what you're doing. There is like a pipeline to where you are. So I am glad that you go ahead and mention that just so they can start being aware.
Yeah,
Well, Mr. Damon, you have shared so much wonderful advice and knowledge and insight into what it looks like being a laboratory director. Just to kind of wrap up our conversation with the last question, what
mhm.
would you tell your younger self when you were at the beginning of your career?
Hmm. I would probably tell myself to continue doing what I did, research the different areas so that I'm a firm believer in actually doing what you like to do and not just stepping into a role because you need a job. So I would
Right.
tell myself that do what you really want to do and make sure that you're the best at it.
Thank you so much for your time today. Thank you for taking the time out of your busy schedule to go ahead and share with our listeners what it is to be a laboratory director and your experience and your career. We really appreciate you taking the time and we loved having you on the show.
Thank you.
You just got one episode closer to learning about the world of jobs out there. To explore the rest of our career categories and find your best fit, go to jobdictionary.com to sign up for the beta users waitlist. Then subscribe here to find the next episodes coming out this week. And as always, drop us a comment, review, or message to let us know how we could better attune our episodes to your specific needs. Follow us on TikTok, Instagram, Facebook, LinkedIn, X, Threads, Pinterest, and wherever else you're on socials to go get our short, snappy preview reels that expose you to new job options every day. Because here at Job Dictionary, we believe your big aha moment can be just one scroll away. Go check it out and get out there. Cheers!